Good morning, everyone. I'm Sean Randolph, Senior Director at the Bay Area Council Economic Institute, and I'm very pleased to welcome you to this F50 Global Capital Summit for 2020. We are a research institute, basically a think tank on the economy of Silicon Valley and the Bay Area in California, and we focus especially on important economic trends in technology, in R&D, in startups, but in the broader economy as well, that impact our region and by definition also impact the world economy. We have an important agenda today because of the timing of COVID-19. I think last year's summit was quite a different event. I think every event being held this year is going to be very, very different. We have a major priority and a major challenge around healthcare globally, but also the impacts on the global economy of COVID-19. And how do we address that? How do we support innovation? How do we move our economy forward together through innovation and technology? So I'm going to give a bit of background about what is happening in the global economy today, especially as it has been impacted by the COVID-19 crisis, and speak a little bit to the role of Silicon Valley and the role of innovation and startups in moving us forward into a new economic era. First of all, I think we have to confront the fact that the economic impacts of COVID have been profound in every part of the world. In April, the International Monetary Fund came out with its predictions for 2020. They were predicting a drop in GDP in the Eurozone to 7.5%, in the UK of 6.5%, Japan a drop of GDP of 5.2%, China 4.9%, major declines in Mexico, Canada. Overall, they were predicting about a 3% contraction in the world economy this year. That compares with a 0.1% contraction in the world economy in the Great Recession of 2007, 8, 9. So this is very, very significant by any standard. About 100 countries now have applied to the IMF for some form of relief. And of course, that affects many, many, many developing countries, even more than it does the major economies around the world. More recently, just in the last week, the World Bank came out with its forecast, which is more recent in that it has the latest data, and it's a little bit more negative even than the one from the IMF. So the World Bank is predicting a shrinkage of 5.2% in the global economy this year. They are predicting a 4.2% rebound next year. So what we're really looking at is an across the board, and this has really been unique in recent history, decline of essentially every major economy in the world over the course of this year. China will fare a little bit better. They will maybe grow 1% according to the World Bank, but that is quite a change from the 6.5% last year. So this is a global phenomenon that is affecting trade, it's affecting investment. The World Trade Organization, if we just talk about trade, is predicting 13 to 32% drop in global trade this year. That's a pretty huge range. And the difference is based on, are you expecting a short decline with a V-shaped quick recovery before the end of the year, or a longer recovery that extends into 2021 and maybe 22? So there's a lot of uncertainty around that. I think we're all pretty much playing this day to day. But it all puts the focus even more intensely on healthcare and technology and innovation. How do we help the world recover, both on the health level, but also on the economic level? And I think the good news is that there is a phenomenal amount of innovation and technological capacity we have available now that has not been available in past crises, certainly not in past pandemics. It really strikes me as amazing thinking about Silicon Valley, where many of us are sitting today, and the role that the Valley has been playing. Aside from healthcare, if we just think about it, we're all communicating constantly now on Zoom. We're on Slack. We're on Microsoft Teams. We're on LinkedIn. We're in Google Hangouts. Facebook is helping us stay in touch globally. We're ordering at home through Postmates and Instacart, DoorDash, Uber Eats. We're watching Netflix much more than we should probably. And what is really remarkable is that most of these companies are located within 20 or 30 miles of San Francisco International Airport. So there is this immense concentration of talent and capacity. When we look at healthcare, the same story holds. There is important work being done around the world to look for vaccines, look for treatments. But as I look at the landscape here in the Bay Area, we are one of the leading areas globally, if not the leading area globally, that is searching for these solutions. We have major institutions such as University of California, San Francisco, Stanford University, University of California, Davis, the Gladstone Institutes that are associated with UC San Francisco. They're all in the hunt full on for treatments and vaccines. But also there's a small army of startups here in Silicon Valley that are doing the same things. Young and younger companies such as Mendel AI, GigaGen, Vaxart are all intensely focused on this. We find some of the larger companies like Gilead Science, Genentech already in clinical trials. Companies like Vir Biotechnology are developing treatments, but doing it jointly with companies such as Biogen in Cambridge, which is working with Vir, and China's WuXi Biologics in China. Kaiser Permanente is conducting clinical trials for a vaccine with Moderna out of Cambridge. Shifting over to the tech side, we have Google and Apple collaborating on a smartphone technology that will enable tracing of contacts for as many as 1/3 of the world's population. And even things people don't often think about. So 23andMe, the genealogical company, has a massive genealogical database. And they're using that to search for COVID-19 patterns that could also better enable contact tracing. Intel is working with Lenovo out of China and Shenzhen BGI to speed genomic sequencing of the virus through supercomputing. Cepheid has gotten early approval from the FDA for a COVID-19 test that could be administered at the point of care with results within 1 hour instead of waiting for days. And you have the laboratory, the inventor of CRISPR, Innovation Genomics Institute at Berkeley, collaborating with the Chan Zuckerberg Initiative, BioHub, on technologies that would accelerate testing volume. And this could go on and on. It's just remarkable the intensity of focus how Silicon Valley has come together between big companies, universities, and startups to address what's going to be a common challenge. One of the things that is really striking about this, though, is that it's not just Silicon Valley. It's clear that innovation is collaborative, innovation is global, and a lot of this research that is underway is happening on a global level, as you just heard, between companies here in the US, companies in China, companies in Europe, and elsewhere. It's unfortunate that when you would hope that a global health crisis such as this occurs, it would bring countries together. I would have hoped that the US and China might have been able to lead this together. Unfortunately, that's not proving to be the case. It appears to be driving them, at least at the governmental level, farther apart. However, the good news is that if you go below that governmental level, we're finding really deep collaboration and cooperation between companies here in Silicon Valley, companies across the US, and their counterparts, scientists in universities, scientists at private companies across China. And that is really encouraging. And it does show also that science matters. Some debate in our administration the importance of science. I think there's no question at all, but the science is critical to our ability to go forward. So I think to draw a bottom line on these few thoughts, I have a lot of confidence that innovation ecosystems around the world are going to rise to the challenge as economies and as societies reconfigure. We know that investors are retrenching to some degree. A lot of startups are needing to extend their revenues, extend their investment funds for a long period of time. A lot of them won't be able to do that. But we know also there is going to be new investment, there is going to be strategic hiring, and while terms will tighten on many investments, there is going to be ample venture funding for the right kind of companies, and perhaps some more patient capital making long-term strategic bets. So strong companies, we know, have often been built in very challenging times. Some of our best global companies in the Valley came out of the Great Recession of 2009, and we are benefiting from their developments even today. So need and necessity are going to drive markets, especially around healthcare. They'll have a lot of focus shifting now toward biotech and healthcare. New companies are going to be emerging to meet them. Other companies will be repurposing and refocusing and reconfiguring. But as that happens, innovators, investors, and others will continue to place their bets in Silicon Valley and at other global centers of technology around the world where science, financial capital, and human capital concentrate. So I hope that's been a bit of a helpful background for the more detailed conversations that will follow over the next 2 days around healthcare and healthcare technology and the capabilities of our innovation systems here in the Valley and around the world to address this major challenge. But it will also be an opportunity for a lot of our best minds and our most innovative thinkers and companies to emerge from this successfully. Thank you very, very much for joining us.